We are going to get started. Again, if you are able to, please join our interactive lesson. You're going to go to join.nearpod.com and type in the code that you see there, which is SFWBV. If you are watching the live recording, please know that you will not be able to join the lesson. However, you can still kind of watch through and have that same interactions. So, welcome to week number 2. We all made it. I know week 1 gets a little nuts, but you guys did it. You made it through week 1. You should be really, really happy with yourselves. Now that week 1 is over, do you guys have any questions about anything that happened last week, anything that was graded last week, any feedback that you were given? If you have any questions, now is the time to ask me. You can unmute yourself and ask, or you can drop it in the chat box and I will answer it as I see it come through. So if you have any of those things, please don't hesitate to ask along the way. So for this week, for week number 2, we're going to be looking at 3 chapters for content. We're going to be looking at chapter 4, which is going to talk about body structures. We're going to talk about chapter 5, which is going to deal with the integumentary system, which is dealing with like your skin. And then we're also going to have the module 10, which is discussing the musculoskeletal system. So bones, muscles, tendons, joints, all of that kind of wrapped into one. So let's go ahead and get into what our content will be for the week. One of the first things that I like to discuss as we're kind of coming up and talking about word parts is what you're going to see in relation to the body structure. So when we talk about body structure, it's really starting from the very basic of what we consider an atom. So the basic forms of life, an atom, combining together to create cells. Now, when we talk about a cell in medical terminology, we use the word part cyte, C-Y-T. The combining form is cyto, and you're typically going to see it like it will look much like a suffix because it will come towards the end of a word. However, it is not a suffix. It is talking about that word part. So in our example here, we have the term erythrocyte. Erythro is the prefix in this case because it's notating a color. So erythro is red, cyte is cell. So this term here is a red blood cell. Once a group of cells form together, they form a tissue. In medical terminology, the word part that means tissue is hist, H-I-S-T. The combining form is histo. And in our example here, we have the term histology. So histo we know means tissue. Ology means the study of, and that is a suffix. So our term here means the study of tissues. Once a group of tissues form together, they form organs. And then once a group of organs form together, they form an organ system. So things, for example, like your cardiovascular system, your musculoskeletal system, your integumentary system. And then once you have a group of systems working together, you have a full, complete organism, which in this case is the human body. But going back, we have the term nucleus, which you find in atoms, right? They're the center of atoms. And because medical terminology is made up of both uh, Spanish words and then English words, and then we have a little bit of, different languages in there, we have 2 terms that actually mean nucleus. The first one, the word part is nuclei, so N-U-C-L-Y. Word part combining form is nucleo. And we also have Kary, K-A-R-Y, and O is the combining form. So you can have mononucleosis, which is talking about a disease virus, technically caused by the Epstein-Barr, that causes an issue and causes problems within the body. So nucleo is in the middle there, and that is still a word part meaning nucleus. And then kerocyte is a nucleus cell. So what you would find in the middle of that atom. So I'm going to try to start every one of the lessons with some word parts, but then I'm going to also try to do a little bit of interactions so that way you guys get to learn the terms hands-on. Because if you had to listen to me for an hour, trust me, nobody would be successful in this course. So I like to make sure that you guys do have that interactions to learn from. So, because this chapter is really talking about body systems and body structures, one of the first things that we really need to talk about is this term called the anatomical structure. Um, the anatomical structure refers to how we actually talk about the body in reference to points of contact, middle, breaking it into quadrants, breaking it into sections, breaking it into right and left halves, but it also helps us to notate where like underlying body organs are. So if a person is in the anatomical position, this means that they are standing erect, so standing upright. They are facing forward and their arms are at their side, but their palms are also facing forward. That is what we call the anatomical structure. So with that, that helps us to break up our body planes as well as our body cavities, as well as our different anatomical regions. We're going to talk about what all of those are in just a few minutes. When we talk about planes of the body, it's talking about how we notate what the body looks like. So we have the frontal or coronal plane. So that's obviously everything facing forward. We have the sagittal plane, which will actually break your body into right and left halves. And then we have the transverse plane, which will break your body into superior or top and inferior or bottom. Now, one of the other parts that we talk about are some body cavities. And when we talk about body cavities, these are created by the planes of our body, and they are spaces within the body that help to protect, separate, and support any internal organs. There are two major cavities that are within the body, and they break into smaller cavities, but the two big cavities are, the first one is called the dorsal cavity. Dorsal cavity is also called our posterior cavity, and it's going to contain your cranial and your spinal nerves, so your head and your spinal nerves and spinal cavities. The ventral cavity is also called the anterior cavity, and that's going to include the thoracic and the abdominal pelvic cavity. So what we see in the front is going to be your sort of like where your lungs and your stomach are. What we see in the back cavity is where your spine and your brain and spinal cord are. And one of the last things that we really talk about with body structure is talking about these directional terms. Now, when we talk about directional terms, it's to help us understand points of origin or where an injury or an illness has occurred. So some of the terms that we have are the terms medial and lateral. Medial is going to be pertaining to the midline of the body, so the middle of the body. So for example, standing like this, my elbow is medial to my body because it's closer to the midline of my body. My palm or my hand is lateral. It's pertaining to the side of my body. It's farther away from that midline point. Superior and inferior are our next set. Superior means up towards the top of our head or above a structure. Superior means that it's lower or away from the head of the structure. So if you think about that transverse plane that cuts us in half from top to bottom, my feet are inferior to my head and my head is superior to my belly. Proximal and distal are our next terms. Proximal means that we are nearer to the center or the trunk of the body or the point of attachment. And then distal means that we're further away from the trunk of the body or that point of attachment. So for example, okay, my shoulder is proximal to my body, right? Because it's closest to my body, but my fingers are distal from my body. They're further away from that point of origin. And then the last two terms are anterior and posterior. Anterior means front or the front of the body. Posterior means the back or the back side of our body. All right, let's see if you've picked up on some of these terms with a little matching. So on your screens, you should see some pictures. Now, we didn't talk about these terms, but if you have done any of your reading for this week or any of the interactive activities, these words are not uncommon to you. So we've got the terms adduction, flexion, pronation, extension, supination, and adduction. I'm going to give you a minute, let you go through those, and then we will come together and talk about what those answers are. All right. So in looking at these, the first one I want to talk about is going to be the term flexion and extension. Those two terms are going to go together. Flexion means to decrease the angle of a joint, and extension means to increase the angle of a joint. So in looking at what we've got here, this one is going to be flexion. Okay. And this one here, if you can see the arrows are going away, they're extending out, that's extension. Next, we have the terms adduction and abduction. Okay, so adduction, ADD, because I know sometimes my verbiage can sound exactly the same on a recording. So adduction, ADD, means to move closer to the midline, and abduction, ABD, means to move further away from the midline. So in looking at this, you can see that this hand is kind of going away from the midline. Away from the midline. That is going to be adduction. Oops, I'm sorry. Nope, abduction. See, I even get it wrong sometimes. This little hand, if you look at those arrows, are coming back in. That is going to be adduction. And then the last two that we've got on our screen here are pronation and supination. Pronation means to turn palm up. So pro is up because I think about pro being good or positive. So that's palm up. And then supination is going to be palm down. So in this case, when you look at the terms here and we look at this picture, we've got palm going from up to down. That is going to be that picture is backwards. Yep, those pictures are backwards, and that's on me. That's not on you. So if you got them, good for you. But I did the pictures backwards. Sorry, it happens. Brain farts. But so if I'm going palm down, that is actually supination. Palm up, that is actually pronation. But I'm an idiot sometimes, and I did them backwards. So I apologize. All right. Let's do another set of matching terms. So here we have the terms inversion and eversion. We have the term dorsiflexion, the term plantar flexion, and then the term rotation. So let's see if you can get these. Inversion, eversion, dorsiflexion, plantar flexion, and rotation. Now, if you are wanting to do a little bit more with this, or you're wanting to learn a little bit more, or maybe see some pictures that kind of go along with this, it's going to make absolutely no sense when I say it, but these are actually located in chapter 10, which starts on page 300 in your book, and you can actually kind of see those pictures a little bit more. So if you're wanting to have a little bit more with that, that's where you can find a little bit more. All right, so the first one that we have is the term inversion. Inversion is going to mean to move your sole of your foot inward. So move the sole of your foot inward. So that is going to be this side. So you're going to be more kind of rocking on your sort of pinky side of your toe. And then dorsiflexion is quite the opposite. You're going to be, that's the wrong one. I'm going to unclick that one. Eversion. Inversion and eversion go together. Eversion, you're going to be moving more to the sole of your foot outwards. You're going to be more on your big toe side. Those are what those two terms. Inversion on your pinky side, eversion on your big toe side. All right, now let's do dorsiflexion. This means to elevate your foot. So to put your foot kind of upwards. So if you notice the toes are going upwards here in this picture, that is dorsiflexion. To put your toes downward or to point your foot is going to be plantar flexion. And then rotation means that you are able to rotate or move a body all around its axis. That could be your head completely going side to side, what you saw me doing with my wrist, kind of going all the way around. Your hip flexors being able to move all the way around, shoulders go all the way up and around. Anything that's kind of on that access point, we're able to rotate it fully. All right. So let's talk about some of the other things that you may see in this chapter and talk about them. So we talked about body sort of structures. We talked about their cavities. One of the other things when it comes to the abdominal pelvic cavity is we break that down into different quadrants and we break that down into different regions. They're really used to describe the location of many of our abdominal and pelvic organs more easily, so providers are able to find where the issue really does lie. So because we break that abdominal pelvic cavity into quadrants, quad means 4. So that means we're breaking into 4 sections. We're going to break it straight down the middle and then straight in half. So then we end up with a right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. So, and we notate those just like they sound. RUQ is right upper quadrant. LUQ is left upper quadrant. RLQ is right lower quadrant. And then LLQ is left lower quadrant. Now, when we talk about the breaking down of the regions, the reason that we're doing that is to go even further into figuring out which organs are the issue. But also we do it to, if there are hernias in the stomach area, we're able to then really kind of focus on where that hernia would be and if it is something that needs to be taken care of right away. So the first one that we have is going to be, so we break it essentially into 3s: top, middle, lower. And then we break it into right, left, middle. The top layer is going to be called our hypochondriac, and then we have right hypochondriac, middle hypochondriac, and left hypochondriac. The middle layer around your belly button is called the umbilical, and again, you have right, middle, and left. And then we have the inguinal, which is really sort of lower pelvic area, and again, right, middle, and left for that. Now, when we talked about one of the other body cavities, we talked about how the posterior or dorsal cavity had the spinal column in it. And your spinal column is broken down into sections as well. Now, for safety and for fully understanding it, I did break these into the color coordinated sections so you can really understand it. Cervical is going to be up at the neck area. Thoracic is really right in that kind of like middle back region where your like lungs would be. Lumbar is your lower back. Sacral is actually where your like hip and butt bones are. And then coccyx is all the way down at the end of that tailbone, the spinal column, and we call that your tailbone. All right, so let's do a little interactive activity and see how you guys are faring out with this. So we've got some quiz questions here. And to start off with, the first quiz question that we do have is, what is the term that is meant to lower the foot and point the toes? So what is the medical term that we use, directional term that we use to lower the foot and point the toes? I see some of them coming through. You got it. It is letter C. That is plantar flexion. Its opposite counterpart here is not listed. That would be dorsiflexion, and that means to point those toes upward. Awesome. Question number 2. What is the term for palm up? Palm up. What is that term? The term for palm up. All right, palm up. You guys got it. It is supination. I think I'm just an idiot today, and I think I have them backwards today. Palm up, supination. Its counterpart is pronation. Very good. Question 3. What term means to bring a body part laterally away from the body? Bring a body part laterally away from a body. I see it coming through. You're doing great, guys. It is abduction, ABD. Abduction means away from the body. Its counterpart is adduction, to bring it closer to the body. All right, and question number 4. What does the abbreviation LLQ stand for? You guys are doing fantastic today. Yes, LLQ is talking about those quadrants of the abdominal pelvic cavity, and that is left lower quadrant. You guys nailed it. Great job. All right. So that's now going to move us into our second chapter that we're going to talk about, chapter 5, which is talking about the integumentary system. When we're talking about the integumentary system, we really are referring to the skin, the hair, and the nails. All of those are going to make up those protective coverings all over the body. And believe it or not, the skin is actually the biggest organ that your body has, because your entire body is covered in skin. Almost all the surfaces of your body have hair on them, and your fingertips and toes have nails to help protect them as well. Your integumentary system is waterproof on the surface. And what that does is it helps to prevent fluid loss for our bodies. It blocks the entrance of pathogens into our system. It acts as a receptor for our body to interpret things such as touch. And it also helps to produce vitamin D. So our integumentary system, skin system, has a lot going on in it, okay? So let's take a look at what that really consists of. So your skin consists of 3 layers, and we break these down based off of medical terms. Derm, D-E-R-M, is our word part that means skin. Now there's a couple of other terms that also mean skin, but for this, we're going to just refer to right now derm. Dermis is actually going to be that second layer of skin. So what you see there is going to be all that lies in the second layer. It's the one that contains glands, it contains our hair follicles, it has our blood vessels like capillaries and arterioles. We haven't talked about that yet, so you don't have to know those things. It's a future class. But on top of that, so the first layer is called our epidermis. Epi, E-P-I, means outer or top. So that is the top outer layer of skin, what we can visibly see. And then deep within is our third layer, which we call our subcutaneous layer. This is the layer that's going to contain adipose tissue, and adipose, ADI, means fat. So this is kind of our fat kind of insulation layer, if you will, the layer that helps keep us warm. One of the other things that when we talk about skin or the integumentary system is we are referring to accessory organs. Now, our accessory organs here are going to be our hair and our nails. Hair, again, is found on almost all areas of the body, except for we don't find it on our physical lips, right? We can find it above our lip, but not actually physically on the lips. The nipples for male and female do not have hair on them. They might have hair around them, but not physically on the nipple itself. We don't have it on the palms of our hand or the soles of our feet. And we also don't have it on some of the external genitalia that we have. But again, that's a lecture for a whole nother day. The visible part of your hair is called the hair shaft, and the part that is embedded into your skin, into that dermis layer or second layer, is called the root. And that's actually where you see like the bulb. If you ever were one of those kids that used to like pull your hair out, we all did it, don't lie. But you could look at the end of it and see that hair bulb or that hair root. The other part to our integumentary system that is considered an accessory is going to be our nails. Now, just like before, I stated that, those accessory organs are glands, their hair and their nails. These are all protective pieces to help maintain that integumentary system. Nails will protect the tips of your fingers and the tips of your toes from bruising or injury because the skin that is actually underneath your nail, if you've ever accidentally removed your nail, maybe it got hit with like a heavy object and it popped off or whatever that case might be, that skin is super, super sensitive and can actually be very susceptible to infections. So those nails that we have are incredibly important. Our nails form at what we call the root nail or the nail bed. So right down here at the bottom, and then they actually grow upward. So when a baby is growing or a fetus is growing in utero, their nails actually start forming there, and and you can't really tell, but some ultrasounds, if you've got like the really good ones, you can actually see where, 1 week they might not have those fingernails, but then you go for your next ultrasound and you can actually see that they've grown out and that they're there. So that's how nails grow. All right, let's put together a little matching again. So we've got some terms here for diseases that you would see within a integumentary system. We've got the terms alopecia, ulcer, impetigo, and abscess. Let's see if you can put those terms together. All right, I'm seeing some of them come through. One of the first ones that we do have is our abscess. So abscess in this case is going to be anything that is a fluid-filled or pus-filled sac. So for us, if you look here at this picture, we do see some like redness, some swelling, but we also see this little pustule sac here. This could be acne, this could be a cyst. All of those are going to be considered an abscess. The term alopecia means hair loss or without hair. So that's what we're going to see in this picture down here. An ulcer Ulcer is going to be anything that is an internal sore, typically caused by bacteria or viruses. A lot of the times we can see these, for example, in the skin of the mouth. If you get something like a canker sore, you can see them as bed sores. So this guy here is our ulcer. And impetigo, this is the one that just hurts to look at because it affects our littles typically. But this is a bacterial skin infection that is characterized by these pustules that become crusted and then they rupture, which, doesn't help with the spread of those pieces. All right, before we move on, I want to give you some of the other terms that you could potentially hear in medical terminology for the integumentary system. The first thing that we talked about was dermis or derm, meaning skin. But we also have dermato, which is DERMAT, that's the word root. Dermato is the combining form, again meaning skin. We also have the term cutane, so CUTANE, combining form is cutane O, and that again means skin. I brought up the term adipo, so ADIP means fat. Lip or lipo also means fat, so LIP/O. And steto also means fat, STEAT/O. All of those mean fat as well. The term hydro, HIDR, means sweat. If a person has dry or scaly skin, there's two terms that we use. The first one is itchy-o, so ICHTY, hold on, ICHTHY/O means dry skin. But if it is dry, scaly, and cracked, that is going to be the term xero, XER/O. If a person has hard tissue or tissue that has grown into what looks kind of like a little horn, we call that kerато. So KERAT/O. We use the term melano, MELANO, to determine the color black. So if somebody has like a blackening of their skin, or they have a blackening of an abscess, we would use that term melano. And those are the ones that are going to be big for your course project this week. So that's where I'm going to stop for those ones. One of the other things that I'm unable to see this route. I didn't move anything, Jean. We were still on the matching. I was just giving some additional information on top of what those terms we just went over. That's all. There was nothing that I moved. So I'm going to move it now for you guys. One of the other things that we do talk about are some of our different terms in relation to skin lesions. So if the lesion is solid, meaning that there's no like fluid underneath, no pus underneath, we can either call that a palpule, a nodule, a tumor, or a wheal. But if it has fluid within it, we call that a pustule, a bulla, or a vesicle. So the big thing here to remember, and I can refer you to your book, page 87, you're going to want to know some of those lesional terms for your course project this week, because some of the clinical notes that you're going over are going to be some in relation to the integumentary system and different lesions that a patient has. So you're going to want to know those different terms. All right, let's do a little quizzing, see how we're feeling about integumentary system items. So the first question is, what is the word part that is used for dry or desert-like skin? dry or desert-like skin? I'm going to take a quick drink, guys. You got it. It is 0. Remember, if it's just dry skin, it's going to be that itchio. But if it's dry, scaly, cracked, or in this case, desert-like, we are referring to the term 0. All right, question number 2. What term means scaly or dry? Oh, don't let it trip you up, okay? Scaly or dry. Yes, it is C. It's that itchio. So remember, those two terms are very similar. But that cracked skin, that desert-like skin, that's 0. But if it's just dry and scaly, kind of like what you would see with scabies, that's where itchio is going to come in. Okay. I saw somebody hit adipo. Remember, adipo is referring to fat. Okay. Question number 3, and I already saw some of you answering that. So what word part means sweat? Means sweat. I saw some of you already answer it, so I'm going to go ahead. It is D. It's hydro. Now, I want to make sure that you do understand that hydro with an I is sweat. Hydro with a Y is water. So please make sure you do understand those differences. Question number 4. What does the abbreviation TNM stand for? TNM. I think this one stumped you guys. Don't let it stump you, okay? The correct answer here is letter B. It means tumor node metastasis. It's something that we use to notate if a tumor or this cancerous tumor has spread. All right, question number 5. What does the abbreviation BX stand for? BX. All right, so in this case, BX is actually going to stand for the term biopsy. And what a biopsy is where we take a small piece of tissue or skin and we can actually look at it under a microscope to determine what the illness or injury or bacteria is that's on the skin. We can also use it to look for cancer tumors and things of that nature. And question number 6. What does the abbreviation IV stand for? IV. Very good. IV is something that we use to notate intravenous. Intra means into, ven, VEN is vein, os is pertaining to. So pertaining to in a vein is going to be intravenous. Very good, guys. All right. And we are going to wrap up today with talking about the musculoskeletal system. So the musculoskeletal system is made up of your muscular system and your skeletal system. And the whole point and function of the musculoskeletal system is to provide support and movement to our bodies and to help us fully understand how our bodies move and function. So let's begin talking about that. One of the first things that we talk about is this muscular system. Now, muscles are composed of what we call contractile cells or fibers, and they provide movement of an organ or a body part. Muscles will also contribute to the posture that we have, the production of our body heat, and they act as a protective covering for any internal organs. So our integumentary system is going to protect the outside of our body. Muscles are going to protect the inside of our body. Muscles do make up the bulk of our body. So if somebody is trying to lose weight, and they're going to the gym and they see themselves physically losing weight and the scale says that they're losing weight, um, but all of a sudden they start weighing more, remember that muscle weighs more than fat. So that's what's going to make up a lot of what they're feeling or seeing at the gym if they're starting to see that gain in the scale. There are 3 types of muscles that we do have. We have skeletal muscles, cardiac muscle, and smooth muscle. So skeletal muscles are what we call our voluntary muscles, or also we call them striated muscles. Their job means that they are under voluntary control. So this means that we physically have to move them. So think about the muscles that are in your legs and your arms. We physically move those in order to control them. Cardiac muscle is only going to be found in your heart, and it is involuntary. We do not in any way, shape, or form tell our hearts to pump blood or, do that carbon dioxide oxygen exchange with the lungs. That happens automatically. So it's involuntary. It's also involuntary in your smooth muscles. We also call these our visceral muscles, and they are muscles that act without us telling to do so. So, for example, our stomachs, our gastrointestinal tracts are made up of smooth muscle. Their whole job is to move food from the beginning of our GI system to the end of our GI system, and again, does that without us telling it to do so. All right, let's do a little pairing up here. So we've got some word parts. We've also got some um, combining forms. So we have the terms spasmo, kino, or kine, or kinesio, all meaning the same thing. We have fascio, or fascio, depending on how you want to say that. We have sarco, myo, musculo, teno, tendino, or tendo. So let's see if you guys can get these all together. These are all terms or word parts or combining forms that we would see within our muscular system. I've got a few of you answering. So let's start up here at the top. We've got spasmo. Spasmo is going to relate to a spasm. That can be an involuntary movement of your muscles without your control. Think about if you've ever had like a little eye twitch that happens, that's considered a spasm. Kinesio, kino, or kini, all of those terms mean movement. So think about if you've ever had somebody who says that they're a kinesiologist. They're somebody who deals with the movement of the body. Fascio. Fascio is talking about our fascia. So what we see on the surface. Sarco. Sarco means muscular or flesh-like. Myo. Myo means muscle of or relating to a muscle. I want to be very specific here. Musculo is muscle. And then teno, tendino, or tendo is a tendon. Awesome. The skeletal system is the next part that we're going to talk about. And your skeletal system is obviously made up of bones. And bones really provide the framework for our body. They'll protect any internal organs. They'll help to store calcium and other minerals, as well as produce blood cells within our bone marrow. In the adult body, there are 206 different types of bones, but we're actually born with more. So babies actually have more bones in their body than we do as adults, but as they grow, those bones start fusing together, which create those 206 bones. Really weird and fun, interesting fact. Babies are born without kneecaps. very fun. They don't actually start developing their kneecaps until they're about 2 years old. So that's why it doesn't hurt them to crawl on hard surfaces like cement or hardwood floors, because that's just padding right there, kind of like muscle and tissue. There are no kneecaps. So if nothing else, that's what you'll learn today. Together with your soft tissues, most of your vital organs are really enclosed and protected by bones. And your bones and skeletal systems are not just for support and protection. It also carries out a number of other important functions, things like movement. Movement is only possible because of our skeletal bones and their points of attachment to muscles, tendons, and ligaments. Now, when it comes to bones, there are 4 types of bones that you'll come in contact with if you ever work in something like orthopedics. You'll have short bones, irregular bones, flat bones, and long bones. All right, let's do some more matching. Let's see what we've got here. So we've got another set of either word parts or word roots. We've got the terms oste or osteo, arthro, chondro, kypho, melano, ortho, and scolio. So let's see what you guys can do here. Let's see if you can get some of those together. All right, so I see a couple of answers coming through. Let's go ahead and go over these. The first one on our list here that you guys have is kypho. Kypho is going to be relating to your spinal column, and kypho means that you are humped. So people have like a hump back. Think about, there's a really old Disney movie called The Hunchback of Notre Dame. He had a humped back. He had something we call kyphosis. Chondro. Chondro is referring to cartilage, gristle, granule, or granular. Typically, you're just going to hear it as the cartilage. Scolio. Scolio is going to be talking about the term twisted. So instead of your spine going the way that it should, so the spine has like a normal curve to it, yours will curve or twist the other way. Typically, the disease that we see there is the term scoliosis. Melio. Melio means of or relating to bone marrow or the spinal cord. Ortho, this is the one that trips people up. Ortho actually means straight bones. I don't know what I did, but I got signed out of the Nearpod session. That's okay. Angie, you should be able to rejoin. But at this point, we are just a few slides left. So if you just want to watch on your screen, that's perfectly fine too. I think we have like 4 slides left. So ortho actually means straight or correct. So orthopedics is actually just the study of straight bones. Artho means of or pertaining to the joints or the limbs. And then oste or osteo is referring to the term bone. All right. One of the last things that I do want to talk about is the difference between the terms strain and sprain. These terms, typically people get them confused or they use them and think that they're interchangeable. They're not. A sprain means that you have torn a ligament. A strain means that you have torn a tendon. So how I always like to think about this, strain has the T in it. T is for tendon. Sprain does not have a T, so it's a ligament. Either way, the best way to treat these is with heat or ice and then resting and elevation. All right. Last set of quiz questions here for today. We've got 5 quiz questions. The first quiz question is, what do you call the long main portion of a bone or the shaft of a bone? What do you call the long main portion of a bone or the shaft of a bone? Very good. It is called a diaphyses. Diaphyses. Epiphyses is the short bone. Question number 2. What does the word calcano mean? Calcano. Yeah, calcano is the heel bone. Heel bone. Um, Tibia and fibula are types of bones that we see in the legs. Arms would notate where in the arm it is, but heel bone is the term calcano. Question 3. What does the word root bronchi or bronchio mean? I'm sorry. Yeah, branchi. Branch, branchii. Brachii. Goodness gracious. I'm going to get my terms together. It is the arm. It's actually what we use to notate the term arm. We talk about your brachial artery, but that is located in the bend in your arm. Question number 4. What does the word root femoro mean? Femoro mean. I do see it there. Somebody does already have the answer. So femoro is referring to your femur, and your femur is located in your thigh. All right, and last question for today. What is the word root for bones of the fingers and toes? Bones of the fingers and toes. I see it there. It is phalango. Cyano is blue. Erythro is red. Xanatho is yellow. So all of those are colors, nothing to do with fingers and toes, but phalango is fingers and toes. All right, guys, some of the last things that I want to talk about for this live classroom is making sure that you are doing those interactive activities that you do see in your course, Blackboard course. They will help you with knowledge checks, not only for key terms, but also help you prepare for your course quiz and your course project for the week. There is a study guide for Module 2 going over all of the different key terms that you're going to see for body structures, integumentary systems, and the musculoskeletal system. Best thing that you can do for yourself is take those, make flashcards out of them, and use them for study purposes. Your assignments for the week. The first thing that we do have is your first course project. I know I had a couple of you ask me about the course project already. So with the course project, there are 2 documents that you're going to download. So 2 of them are clinical notes for patients, and the third one is actually a Microsoft Word document. The Microsoft Word document is your assignment. What you're going to do is answer the questions based off of the clinical notes that you have for your patients. The questions are broken into sections. So section 1 is all dealing with patient A, section 2 is all dealing with patient B. You will use the clinical notes as well as your e-textbook and some, if you have to do a little bit of like Google research to answer some of the questions, that is normal. If you use anything outside of your e-textbook, you want to make sure that you do put that as a reference at the end of your assignment, but you also want to reference your e-textbook. If you don't know how to do proper APA formatting referencing, please make sure that you reach out to me and I can kind of direct you on how and where to go to do that. Your Microsoft Word document will then be saved as a Microsoft Word document. If If you save it as anything else, I cannot open it in Blackboard, so I cannot grade it. And you'll put that into the Dropbox Sunday, October 15th by midnight. And then I will get that back to you hopefully as soon as I can with feedback so you can see what you did wrong and so you can move forward in your next course project with more feedback and heads up. You'll also have your first dictation assignment this week. With the dictation assignment, what you're going to be doing is you're going to have patient scenarios or patient charting read to you, right? It's going to actually speak to you. So you want to make sure that you are in a area that is quiet, that you can hear that feedback. The assignment looks very much like a quiz. However, it is not timed. So you can take your time, listen to the patient scenarios as many times as you need to be able to answer the questions based off of the scenario that you hear. You do only get one attempt to complete the assignment though, so please make sure that when you start it, you're able to finish it. You have another discussion board. Please know that the initial discussion board is due today, which is Tuesday, October 10th, and then you need to reply to at least 2 classmates by Saturday, October 14th. The discussion board will close at midnight on October 14th, and no submissions will be accepted after that point. You also have another quiz this week. One attempt, it is timed 20 minutes, so you cannot walk away and come back. It will time you out. If you want after you have completed your quiz to know what you got wrong, please make sure that you send me an email. I am more than happy to give you your feedback on the quiz. I will do it Mondays after the quiz closes on Sunday, so that way answers cannot be shared with your classmates. And then you have your Module 2 live classroom assignment. At some point during this course and in this live lecture, a code question appeared on the screen. All you need to do is put your answer to the code question in the Dropbox for grading. All right, are there any questions that you guys have on anything for this week, anything we learned in the live classroom, or anything from the previous week that I can help you guys with? All right, I'm not seeing any questions pop through. So we are all done. I will hang out in the room for just a few extra minutes if you guys do have questions or if anything comes through the chat while we're waiting. Oh, all right, Angie, go for it. I do see your hand raised.
All the discussion boards going to be in APA format?
Yes, so you don't actually have to do like a cover page, anything like that. It's just making sure that when you are doing your discussion board, if you have resources that you're putting those at the bottom and using any in-text citations. But yes, you will want to write them in APA format.
Okay, great. Thank you.
Of course. Anybody else have any questions? Of course. Thank you, Michelle, for joining us. And I hope that you all have a wonderful week too. Have a great week, everybody. Bye-bye.